Now, if you have a placenta previa, most of the time, your provider is going to put you on something called pelvic rest, and that's where they don't want anything inside your vagina. They're often going to give you some activity restrictions, and that's all to keep you from having bleeding with it. So even if the cervix isn't dilating, theoretically, if we disrupt that lower part of the cervix and bump into that previa enough, into that placenta enough, it could start to bleed. And the risk of previa is that you bleed so much that it can be life-threatening to you and your baby. So you want to avoid doing anything that could disrupt that placenta. Now, the good news about placenta previa is that most of the time they resolve on their own. And they're scary when they happen for most women because you're told you can't have sex and do all these things because you might bleed too much. But the uterus starts out the size of your fist and then ends up very big, right? And so when the placenta starts off down here, as that uterus grows, the placenta goes with it. And then it gets out of the way. But what happens if the placenta doesn't get out of the way? If it doesn't get out of the way, then you're going to be recommended a C-section. And that's for a complete previa, a partial previa, and a low-lying placenta that is too close to the cervix. And that is because we don't want you dilating. We don't want that cervix opening up and letting those blood vessels be exposed so that you bleed too much. So usually if you have a previa, you're actually going to be recommended a C-section around 37 weeks because we don't want any chance of you laboring. Of course, it can happen, but we're trying to avoid it the best we can. I do realize this video got progressively scarier the further along it went. But my ultimate goal was not to scare you. My ultimate goal was to tell you that if you have vaginal bleeding during your pregnancy, try not to freak out because a lot of times it does not mean miscarriage. And a lot of times it doesn't mean anything scary. In fact, the most common cause of vaginal bleeding I find during pregnancy is bacterial vaginosis, a common vaginal infection. But if you're having bleeding, I encourage you to go ahead and get it checked out because you never know what might be going on. And even if you do have a vaginal infection, you kind of want to get that taken care of, right?